My name is Dr. Jennifer Johns and I'm the President of the Victorian Division of the Heart Foundation. I'm also a practicing cardiologist working at the Austin Hospital in Heidelberg and Epworth Hospital in Richmond. Despite the huge advances we've made in reducing the overall mortality from heart disease and stroke over the last 50 years, it still remains the biggest killer of Australian men. So heart disease, stroke and other vascular diseases cause more than 30% of all the deaths in Australia each year. So it's a huge problem that many men don't realise they're at risk from. So men tend to have their heart attacks about 10 years before women. Once they've had a heart attack, their outcomes on the whole are pretty good because of the new generation treatments we can offer them. But one of the problems is that men tend to delay seeking help, partly, probably for many reasons, some of which we don't understand. They delay seeking help because they deny. They often prefer to think that the pain they have is due to indigestion. They think it may go away. They don't want to disturb the rest of the family. They may not want to worry their spouses. For whatever reason, they delay seeking help, and this leads to worse outcomes than could be achieved if they came to hospital quickly. A heart attack occurs when there is blockage of a major coronary artery. These are the arteries which supply oxygenated blood to the heart muscle. So this is to the pump. And the blockage can be caused by a clot. It usually is a clot, blocks the artery, and that area of muscle it supplies is then damaged. Damaged heart muscle leads to a weakened heart. The heart can't pump oxygen adequately, so the rest of the body is denied of the oxygen it requires. Cardiac arrest occurs when the heart stops pumping completely, and that is due either to a very rapid irregular rhythm, which we call ventricular fibrillation, or the fact that there has been so much heart muscle damage that the heart just can't pump. When you have a cardiac arrest, the heart stops pumping, the body, including the brain, does not receive oxygen and the patient dies. The warning signs of heart attack can be quite varied, but the classic features of a heart attack, which many people would recognise, is chest discomfort or tightness all the way across the front of the chest, sometimes radiating up into the throat or the jaw or the shoulders or the arms. It can also be pain felt in the back between the shoulder blades. And this is often associated with a feeling of nausea, sweating, shortness of breath, generally feeling terrible. Those are the classic features of heart attack. However, warning signs can also be much more subtle. They can be predominantly shortness of breath or nausea, a general just unwell feeling in the centre of the chest or the back. And so any abnormal sensation that someone has that's associated with them feeling really unwell should be, a heart attack should be considered. Usually the warning signs of heart attack occur very quickly. So when a patient has a blocked artery and is starting to get heart muscle damage, the symptoms have an onset that's very, very quick. However, some patients get warning signs over several days beforehand, where they get minor episodes of chest discomfort, perhaps while trying to walk quickly up a hill, or sometimes even sitting around or lying in bed. And the episodes may last only a few minutes, 2 or 3 or 4 minutes at a time. And then there is the sudden onset of more severe symptoms that don't let up. So any discomfort which is continuous for more than 20 minutes, we need to think, could this be a heart attack? When a coronary artery is blocked and a patient has a heart attack, this can cause a variable amount of pain. Sometimes there can be mild chest discomfort, other times severe pain. However, it's really important to remember that the amount of pain does not correlate at all with the size of the heart attack. So we say that any amount of chest pain should be taken seriously because it does not reflect the amount of potential heart muscle damage that's occurring. Well, it's really important if you or someone you know thinks they're having a heart attack that you seek help immediately. And this means dialing 000 and asking for help. There'll be an operator on the end who can take a history and help decide whether or not you're having a heart attack. An ambulance can be dispatched. They will come to wherever you are, try and work out whether or not you are having a heart attack. And I always say that if it's a false alarm, well, that's fantastic news. You may not be taken to hospital. You may be taken to hospital where the diagnosis can be really sorted out. But it's really important, if you or someone you know thinks they're having a heart attack, don't call the GP. Don't sit around and wait. Do not drive the patient to hospital. Don't drive yourself to hospital, but dial 000 and ask for help. It's important to remember that a lot of people delay when they seek help for many reasons. They deny their symptoms. They're worried about making a fool of themselves, creating problems for the ambulance service. Sometimes they're even worried about how they'll pay for it. But many people call because they're too embarrassed. They think they may be wrong and they don't want to create more work for everyone. I just remind everyone that no one ever died from embarrassment, but millions of people have died from heart attacks because they delayed too long in seeking help.